Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 weekly update with data accurate through April 28th, 2022. This week, I'm going to address two questions. Are we really past the pandemic phase? And are we approaching herd immunity? So what do I mean by are we really past the pandemic phase? Well, this week, Dr. Tony Fauci was quoted in virtually every headline that you saw was that we were somehow no longer in the pandemic phase. And then that was on Sunday. And then on Wednesday, he started walking back those comments. But what he actually said was, we are certainly right now in this country out of the pandemic phase. And he talked about the numbers and we're at a low level. As people's confusion rose, because they weren't sure what he meant by out of the pandemic phase, later in the week, he went on to correct that his comments were being mischaracterized and the pandemic is not over. He said, quote, "We are not over the pandemic. Don't let anyone get the misinterpretation that the pandemic is over, but we're at a different phase of the pandemic. And that phase is the transition phase." Now, one reason this is confusing to some folks is we typically haven't talked about phases of a pandemic. We've talked about waves or spikes, but phases is a concept that many folks haven't thought that much about. So here's a diagram from the CDC. And what you can see in this simplistic pandemic, this is an influenza pandemic. There's a phase here when there's nothing really going on. And then there's an alert phase, then the so-called pandemic phase, that's a big spike there. Then the transition phase where you're going from the pandemic phase back to the normal phase. And this is the definition is the cases are decreasing, there may be a slight bump in there, but basically coming back down to a normal level. Now, that's a little bit confusing to folks, and perhaps it makes a little bit more sense to look at how the WHO defines influenza pandemic again. And there's a lot of different phases here, but the two I want to point out are here on the right-hand side, what they call post-peak and post-pandemic. And the term post-pandemic is the one that Dr. Fauci was using, or at least that's what folks thought he was using. But the post-peak period is probably the most accurate definition. It's the period of time after the major peaks and that the numbers is coming back down towards normal. Post-pandemic basically means that things have returned back to the normal level. So it was a little bit confusing terminology. Had Dr. Fauci said the transition phase, that might have made more sense to people, or post-peak might have made sense to people, but he was not technically wrong. If you look at where we are today, you can see that the number of daily deaths worldwide is as low as it's been at any time since the first couple of weeks of the pandemic. Now, there does appear to be a slight increase there, which we'll have to keep an eye on. But over 6 million recognized deaths, perhaps more, as we've talked about before. And last week, over 20,000 deaths, which is a couple of thousand more than the week before. So again, something to keep an eye on, but clearly we are post-peak at this point. It's perhaps clearer in the United States. If you look at cases in the US, of course, there's that huge spike related to the Omicron variant. But now if you look, you see this increasing number of cases. If you look at hospitalizations, again, we're nowhere close to the peaks before, but there does appear to be a slight increase in hospitalizations. Fortunately, we're not yet seeing the increase in deaths. And if you look at deaths overall, we've had 1 million deaths in the US, about 2,500 last week. And if you look, we're actually at the lowest point we've been at any time since 9 months ago. Now, you might look at this and conclude that we are post-peak, post-pandemic, transition phase. But the reality is nobody knows. Because if you look back where we were 9 months ago, it looks very much like it does today. This progressive multi-week decrease in cases, And to be honest, nobody knows what's going to happen next. And it's a little bit worrisome that we continue to watch this resurgence of cases in the Northeast. Again, whether that's going to spread to the rest of the country or not, we don't know. Whether these cases are going to be significant enough to cause increases in hospitalizations or deaths, we don't know. But right now, I think technically you can say we are in a transition phase. We are perhaps post-peak. I don't think we can say we're post-pandemic phase, at least in the United States. Now, related to that is this idea of herd immunity. And if you'll recall, it was about a year ago that we first started talking about herd immunity in these weekly updates. And you may recall, if we use this example, if you take a group of 100 people, all of whom are susceptible, none are immune, and then an infectious disease arrives, you get cases, the initial cases in blue dots, and then secondary spread in green dots until a lot of people are infected. And if it's a serious disease, a lot of people have died. Now, what if you take the same number of 100 people who are all susceptible, none are immune, you vaccinate 75% of them, now the immune are shown in yellow dots, the disease strikes again, you get a few initial cases, but relatively few secondary cases. That's because those people who are not immune are protected by the large number of people who are immune. And that's what we call herd immunity. And early in my weekly updates, we sort of thought that our target for herd immunity might be 80% or so. And you all may recall the herd immunity thermometer that we used for a while. The problem was it was hard to know what the actual number of natural infections was. And so we were coming up with low estimates in the 45 range. If the ratio was 4.6 actual infections, so on and so forth. So we really didn't know. And that's why we stopped using the herd immunity thermometer, but with this idea that somewhere around 80% or more, if we get that many people protected, we'll probably see a slowing of the pandemic. So where are we now? Well, this week there was a very important report from the CDC published in the Morbidity Mortality Weekly Report. And what they looked at was what percent of Americans have evidence of having been infected with COVID. Not the vaccine, but actually infected. And what they found was between December of 2021 and February 2022, the number of people who'd been infected increased from about 1/3 to almost 60%. And of course, that was largely due to the Omicron variant. Remember that huge surge in cases. Interestingly, they found 75% of kids showed evidence of infection, with about 1/3 of them coming in since December. And one of the important findings of this, didn't get reported as much as it should have, was that the increase in seroprevalence, increase in the percent of people that got infected with COVID, was largely related to the groups that had the lowest vaccine coverage. So those two top lines are 0 to 11 and 12 to 17-year-olds. And what you can see back in September, 37 to 40% of them had been infected. By the end, it was up to about 70%. Conversely, down here, the 65-year-olds, it looks like 15 to 20%, up to about 20 to 25%. Now, why is that important? Well, because those are the groups, the lower ones, are the ones likely to be vaccinated. Here's fully vaccinated in the United States right now. And what you can see is those in the older age groups, 81 to 90% are vaccinated, whereas the younger folks, much, much less. And that's why the last few months, as Omicron was spreading, we saw more people getting infected who were unvaccinated. This is a great argument to get vaccinated. But it's also an argument to raise the question, well, if this many people are now infected, if 57% of adults have had infection and 2/3 of adults have been vaccinated, should we then conclude that 85% of adults are immune and that we've therefore reached herd immunity? 85% is calculated because if 57% have had natural infection, that leaves 43% who haven't. But if 2/3 of them, 66%, have been vaccinated, that comes up to 85%. So should we conclude in America today that 85% of adults are immune to COVID and essentially we've reached herd immunity? And the answer is maybe, but also maybe not. Part of the reason is, yes, 57% of adults have had COVID at some point. But as we well know, immunity to COVID wanes over time. After 6 to 8 months, it's well low. So whatever percent of that 57% had their infection more than 6 to 8 months ago, they may well not be immune. Additionally, of course, we don't know whether immunity to previous strains of COVID, SARS-CoV-2 will protect us against future strains. And as long as the virus continues to spread around the world and in populations here in the US, there will be new strains. And we know there will be new strains in the US because only 2/3 of Americans are fully vaccinated, and just over half of people in a state like Tennessee have been vaccinated. So that means a large number of people are going to get infected, which means the chance of a variant will continue to rise. And then, frankly, we don't know whether 80% is a magic number or not. But even without this, I think we can reasonably conclude that given that most of that 57% were infected, about half of them infected in the last 6 months because they got the Omicron variant, we probably are somewhere close to 80 to 85%. And what we would expect to see is, yes, we'll see cases, but we won't see the serious hospitalizations and deaths except in those people who haven't been vaccinated. So the CDC says vaccination remains the best strategy for preventing complications, including hospitalizations. And vaccination following infection provides additional protection. So even if you've had a documented case of COVID, the CDC is recommending that with your consultation of your healthcare provider, you be vaccinated. And staying up to date with vaccination is recommended for all eligible persons, including those with previous SARS-CoV-2 infections. So people like me, I've been vaccinated twice and boosted twice, and I would encourage everyone who is appropriately in an age group or a risk category to do the same thing. So are we past the pandemic phase? Maybe. Are we in a transition phase? Possibly. Are we post-peak? Yes. Will it come back? We don't know. Chances are, at least in the US for a while, we probably won't see another spike, at least in hospitalizations and deaths, because we probably do have some level of herd immunity. A little bit of a complicated topic this week, but I think there are important ones. If you have any questions about what I've talked about this week or any other time, please let me know. There's a great deal more information about COVID-19 on the College of Public Health website. If you would like to be added to our mailing list, please let me know. Please feel free to share these videos with other people. Obviously, the more folks who see this, the better questions we get, and hopefully the better information people have. I'd like to thank Dara Young, as always, for editing, producing, and posting this video. And seriously, if you have any questions, please let me know. I very much look forward to hearing from you. Until next week, please be well. Thank you.